I am Dr. Sridevi KN. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. Eating spicy foods or non-veg food, does it cause piles? A lot of people have asked me this. But see, if that was the case, if only spicy food was the cause, then each and every person that eats spicy food should develop hemorrhoids. It is not as simple as that. There are a lot of factors, so it may be a lot of things. A person who eats a lot of spicy food, does not take enough water, does not have any other diet balanced apart from spicy food, has a very sedentary lifestyle. So these are a number of things which should be accounted for. Spicy food alone, yes, can cause irritation and burning in the anal area, especially if you have consumed raw spicy food. But that alone should not be the cause of hemorrhoids in all patients. It definitely can lead to hemorrhoids in some patients because it will cause congestion in the anal canal. It causes congestion in the entire lining of your intestine. But it's just that the anal canal and the mouth are the most sensitive to burning. So these areas, you can develop ulcers in your mouth, you can develop hemorrhoids in the anal canal. So spicy food is bad for your entire intestine, but yes, it is prominent in your anal canal. So most patients with piles or hemorrhoids do not need any treatment at all, and depends on what herbal remedies the patient is talking about. It can help, it can worsen depending on what symptoms you have. So unless you know that you have hemorrhoids and that it need not require any further treatment, I would not advise any patient to undergo herbal or home remedies without seeking any sort of advice from a professional. Sitting on any surface for a very long time can definitely cause hemorrhoids, especially external hemorrhoids. If there is a lot of friction, if patients are wearing extremely uncomfortable, tight clothing in hot, humid weather, and they remain seated for a long time on cold surfaces, if they have a lot of two-wheeler journeys, if they have to undergo long distance two-wheeler travel where there's a lot of friction just outside the anal canal. These are all multiple reasons why you can develop small external hemorrhoids, and that can cause discomfort to you. Piles, fistula and fissures are anatomical problems, and sexually transmitted diseases are infective problems. So to make it more simpler, piles, fissure and fistula is something that is in your body and that can happen to you regardless of whether or not you are sexually active. So somebody who is a virgin can also develop piles, fissure and fistula because this has nothing to do with sexual activity. On the other hand, extremely aggressive sexual activity can also cause tears in the anal canal, can lead to infections which can cause increase in the piles. It can cause a tear such as fissures, and it can lead to the formation of fistulas. So I would not say that piles, fissures and fistulas are sexually transmitted. They are completely two separate things, but it can be seen in both individuals who are sexually active and patients who are not sexually active. Unfortunately, I think because a lot of lifestyle changes are occurring in the present day, we have seen hemorrhoids in patients as young as 4 and 5 years old, and in patients who are extremely elderly in their late 90s. I think this is simply because of a drastic change in diet and over westernization of diet, where we are consuming a lot of simple carbohydrates, a lot of fried foods, and there is a lot of sedentary lifestyle which is predominant from very young children to extremely old individuals. So I don't think it is just in older people that you see hemorrhoids anymore, but across all age groups, across all genders, hemorrhoids can be present in anyone and everyone. So piles always bleed is a myth, and also everything that bleeds is due to piles. That is also a myth. So piles does not have to always bleed. Piles can present as nothing. Patient can just present with some mild discomfort. It can cause bleeding, it can cause pain, it can be seen as a swelling. So piles can present in various forms, not necessarily as just bleeding. And on the other hand, if you have bleeding, it's not necessary that it's just because of piles. It can be due to a multitude of reasons. So do not assume that all piles will bleed, and also do not assume that if it is bleeding, it has to be piles. If you do have piles, there are certain exercises that you must avoid, especially lifting heavy weights and doing squats with heavy weights. But apart from that, regular cardio exercises such as walking, swimming or running, jogging, these shouldn't be a problem. And also, if you are somebody who likes to do weight training separately for different parts of the body, then yes, you can go ahead and do it. But just avoid exercises where you will feel that there is a lot of increase in the pressure in the anal area. So most patients with piles do not require any treatment at all. Some patients require mild changes in their diet, lifestyle and their toilet habits. Some patients respond very well to medical treatment such as creams or ointments, syrups or tablets. That is, a majority of the patients fall under these three categories. Over 70% of them do not require any treatment. Some patient where all these other options fail, they require surgery for the treatment of piles. I am suffering from piles. What can I do to make sure my children don't suffer from piles? So to be very honest, piles is not a genetic problem, it is a human problem. The earliest studies on piles always said that the price that humans paid for being biped or for being able to walk is that they developed hemorrhoids. So as we went from a crouched position to a standing position, we sacrificed a lot of things, and one of those is the tendency to form hemorrhoids. So anyone who has to stand for long hours can develop piles. Standing for long hours, sitting for long hours, over centuries of evolution, hemorrhoids is the price we have paid for being biped. This is one of the theories. Of course, the other factors such as training to pass stools, very raw spicy food, lack of exercise, lack of adequate water intake, these are all the causes that are known to lead to the formation of piles, and it is not necessarily a genetic disorder but a human disorder.